Good morning, ladies and gentlemen, boys and girls. This is your weekly dose of Tooth Teacher Tuesday. I'm your host, Dr. Steven Zahm, kicking it here on Labor Day weekend in my home office, and like always, just talking teeth today. So this week we're doing another episode of our Oral Pathology Corner, and thought it would be appropriate after some of the previous topics we talked about to talk about oral cancer. That's ultimately the concern that we have with any kind of oral pathology is, could this be just an early warning sign that it's cancer, or is it some other minor pathology like what we've talked about previously? So, biggest thing with oral cancer, most forms of oral cancer are going to be specifically a squamous cell carcinoma. That's going to be the most common type, and there can be many different causes of it. Anything from, high risk behaviors like smoking of tobacco or other things that you smoke, alcohol use, whether in excess or not. And then other things like, we previously talked about HPV, the human papillomavirus. Certain rare strains of that can cause, it's not so much oral cancer, but more kind of throat and neck cancer, but can also affect the oral cavity as well. Those are just some risk factors for oral cancer. The list goes on and on, of course, but as I said, most oral cancer is going to be a squamous cell carcinoma. I'll show you pictures here in a second, but it's also possible to get many other types of oral cancer that are more rare. For example, it's possible to have a melanoma inside your mouth. Uncommon, but possible. And then various different types of tumors related to the salivary glands and certain types of cysts that can develop into cancers. And that's why when you see your dentist for your periodic checkup, they should be checking not just your teeth, but all of your soft tissue for any signs of anything unusual. And that's also why we recommend at most every 5 years getting a panoramic x-ray, the big x-ray that goes around your head a couple times. That helps us visualize sinuses, your upper and lower jaws, your jaw joints, and looking for a lot of different things, but one of those things that helps us screen is for any signs of any kind of cancer in the head and neck region. So anyway, as I've mentioned previously, oral cancer typically will start, specifically squamous cell carcinoma, will start kind of as a little reddish white sore in the mouth. And that's why I always say if you've got a sore in your mouth, it should heal in about 2 weeks if it's nothing to be worried about. If it's not healing that quickly, doesn't necessarily mean it's cancer, but it certainly warrants concern and warrants a visit to a dentist to have it biopsied to confirm exactly what it is. Because oral cancer can range anything from something mild and unassuming, such as this, to severe oral cancer where you hear stories about people having all or part of their tongue removed, part of their jaw removed, severe cases such as this. And before I show this picture, if you're squeamish, might not want to look at this picture. I would just turn away because kind of graphic. And so if you looked away, you can look back now, but oral cancer has unlimited ways of presenting, and that's where we as dentists are trained to not only look for what's normal, but look for something abnormal. And so like any cancer, the sooner oral cancer is detected, the quicker it can be treated and the better the prognosis. So that's kind of the ins and out of oral cancer, kind of a quick overview of it. But like always, if you ever have anything that you're concerned about in your mouth, don't assume it's nothing to ignore. Have your dentist check. Better safe than sorry. Like any cancer, it's nothing to mess around with. So hope you found this educational. Thank you for tuning in today, and we'll see you on the next episode of Tooth Teacher Tuesday. Have a great week, everybody.